You know how sometimes it feels like your mind has a mind of its own? Like there's this little voice in your head that, well, it isn't always on your team. Today, we're going to unpack something called cognitive behavior therapy, or CBT. And it's so much more than just a therapy. It's like a user's manual for your brain. It teaches you how to actually become the master of your own mind. And it all started with this really surprising discovery way back in the 1960s that turned our understanding of mental health completely upside down.
Okay, so picture this. It's the 1960s, and we've got this psychoanalyst, Dr. Aaron Beck. Now, his whole goal was to prove that traditional psychoanalysis was the real deal. But in a kind of amazing twist of fate, he ended up stumbling onto something that would pretty much change, well, everything. So, Dr. Beck is in a session, listening to a patient talk about her life, when all of a sudden, she says she's feeling really anxious. He does the classic psychoanalyst thing and suggests, maybe you're worried I'm criticizing you? But she comes back with, no, I was afraid I was boring you. And for Dr. Beck, that was it. That was the light bulb moment. He realized, wait a minute, there isn't just one conversation happening here. There's a whole other stream of thought, a hidden one, running just beneath the surface. And here's what's so wild about this. Dr. Beck figured out that this second stream, it wasn't just random mental noise. Nope, it was like a running commentary. Super quick, super judgmental, and it was all happening just outside of our conscious awareness. But here's the real kicker. This second stream was directly wired to how his patients felt. It was the source of their emotions. He gave them a name, automatic thoughts. And that's exactly what they are. They just pop into your head like a notification on your phone with absolutely no effort. And the thing is, most of us just accept them as 100% true. We don't even question them. And when Dr. Beck looked at his patients with depression, he saw a really clear pattern. Their automatic thoughts were just relentlessly, overwhelmingly negative. And this discovery, this is what led to the absolute core principle of CBT. And honestly, it's a little counterintuitive at first. It's this. It's not the situation you're in that makes you feel a certain way. It's how you think about that situation. Your thoughts are like this filter between you and the world. Your feelings don't just happen, they actually follow your thoughts. Think about that for a second. Okay, let's make this super clear with a perfect example. Check this out. The situation is exactly the same for two people. They're reading a book, but just look at the difference between reader A and reader E. Reader A thinks, hey, this makes sense, this could be really helpful, and feels excited, so they keep reading. But reader E has a totally different automatic thought. This is too hard, I'm so dumb. And that thought leads to feeling sad, which leads to them just shutting the book and turning on the TV. It's the same book, but two completely different realities, and it's all because of that one little automatic thought. So what begs the question, right? Where do these automatic thoughts even come from? Well, they don't just appear out of nowhere. They actually spring from these deeper, more fundamental beliefs that Dr. Beck called schemas. And the best way to think about a schema is like a pair of glasses. It's a core belief you hold about yourself or the world, and it literally colors everything you see. And this is the really critical part. This is how a negative schema keeps itself alive. Let's say your core belief, your schema, is I'm incompetent. Anytime you get information that confirms that belief, like making a mistake, it's like Velcro. It sticks right away. It fits the narrative. But what about positive information? Like, say, your boss gives you praise? Well, that's like Teflon. The schema just lets it slide right off. You'll discount it, oh, she's just being nice, or you won't even register it. And just like that, the belief becomes a self-fulfilling prophecy. Okay, let's make this super concrete. Let's meet Sally. She's 18, a freshman in college. To everyone on the outside, she seems like she's doing just fine. But inside, she's really struggling with depression. And everything she experiences is being filtered through this one really powerful core belief. I'm incompetent. All right, so if these automatic thoughts are the root of the problem, what on earth do you do about them? Well, this is where CBT gets really practical. It doesn't just say, hey, notice your thoughts. It hands you a toolkit. It teaches you how to become a detective of your own mind, to put your own thoughts on trial and see if they actually hold up. So for Sally, a huge automatic thought, especially when an exam is coming up, is this one: I'll flunk out of school. And in that moment, it doesn't just feel like a possibility, it feels like an absolute fact. And that thought just floods her with anxiety and sadness, and you guessed it, makes it pretty much impossible for her to even start studying. So how do you possibly fight a thought that feels so incredibly real? Well, here's the secret. You don't fight it. You don't argue with it. You investigate it. A therapist helps you become that detective. And the very first tool they hand you, the number one question you learn to ask, is simple, but it is so powerful. What is the evidence?
So, a therapist might sit down with Sally and literally draw out a table like this one. On one side, they'll list all the evidence that makes the thought feel true. But then, on the other side, they'll dig for the evidence that it's not true. And when you see it all laid out like this, that big, scary thought, I'll flunk out, starts to look a lot less like a cold, hard fact and a whole lot more like a really biased opinion.
And the investigation doesn't just stop there. There are a ton of other great questions in the CBT toolkit to help you get some perspective. Things like, is there another way to look at this? Or, what's the absolute worst that could happen, and could I handle it? But that last one, what would I tell a friend? Man, that one is so powerful, isn't it? We're almost always way kinder and more logical when we're helping a friend than when we're talking to ourselves.
But here's a really important thing to get. CBT is not just about thinking. It's not just some mental chess game. It recognizes that our thoughts, our feelings, and our behaviors are all tangled up together in a feedback loop. And because of that, sometimes the fastest way to change how you feel is to change what you do.
There's a name for this, and it's called behavioral activation. The idea behind it is actually pretty simple. When you're depressed, your world gets smaller and smaller. You just stop doing things. Behavioral activation is the antidote to that. It's about deliberately, strategically scheduling activities, even tiny little ones, to start pumping a sense of accomplishment and even pleasure back into your day.
So this is what a typical day looked like for Sally before CBT. And you can see the cycle, right? It's a downward spiral. The inactivity makes her feel worse, which then just makes her want to do even less. It's the classic depression trap. And man, it is incredibly effective at keeping you stuck. So instead of that, a therapist helps Sally plan a day that looks more like this. And just look at how small and manageable these steps are. The goal here is not to suddenly conquer the world or have some perfectly productive day. Not at all. The goal is just to break that cycle of doing nothing, to get a few small, achievable wins on the board that start to build a sense of, hey, I can do this.
Okay, so when you put it all together, challenging your thoughts, changing your behaviors, you start to see the real goal of CBT. And this is so important. It is not a quick fix. The real, lasting power of this approach is that it's not something a therapist does to you. It's a set of skills that you learn for yourself for the rest of your life.
And as Sally started to practice all this, day by day, questioning a thought here, scheduling a small activity there, she had this profound realization. She was actually gaining a sense of control. She was learning that her thoughts and feelings weren't just random weather patterns that happened to her. She could actually influence them.
So what can you take away from all this for your own life? Well, it really boils down to this lifelong toolkit. First, you learn to identify what's going through your mind when your mood shifts. Second, you evaluate those thoughts. Don't just take them at face value, question them. Third, you act. You choose your actions based on your goals, not just on how you feel in the moment. And finally, and this is the big one, you practice. This stuff is a skill, just like learning an instrument or a sport. The more you do it, the stronger you get.
When you get right down to it, CBT gives us a really powerful choice. It reminds us that we are the ones telling the story inside our own heads. We're the authors of our own internal narrative. So the question it leaves us with is, well, it's a big one. If your thoughts are literally shaping your reality, what story are you going to choose to tell?